Hello, I'm Dr. Ryan Stratford, a urogynecologist at the Women's Center. I'm going to speak a little bit about how you can surgically treat urinary stress incontinence, leakage from coughing, sneezing, or laughing. In a previous video, I talked about conservative treatments. I'd recommend trying conservative treatments before considering surgery. However, the good news is surgery is very successful, and it's actually very easy to undergo. Over the years, this has been a problem for so many years that they've tried lots of different surgeries. In fact, over 40 surgeries have been devised in an effort to treat stress urinary incontinence in women. There, over time, were improvements in how to treat this surgically. And we developed a gold standard treatment that essentially tried to support the urethra. So let me show you once again where this problem occurs. As you can see in this diagram, the problem with leakage occurs with support to the urethra. Here's the bladder, and here's the outlet to the bladder. If that support's broken down and someone strains, coughs, sneezes, or laughs, then a little bit of leaking may occur. So the initial attempts at fixing this problem were to try to create support to that area. And that was done by either using suture to support that or by harvesting tissue from the side of the leg or stomach and creating a little sling underneath that urethra. And that would work fairly well. However, over time they developed a more effective way. More effective both because it's easier to undergo and has better long-term success and short-term success. And that's called a mid-urethral sling. And it's done by using synthetic material, mesh. Now the term mesh scares a lot of patients. This material is safe. It is suture material woven together. However, where it's placed in the body matters a lot. So using it for urinary incontinence or a sling for the urethra is very safe. However, using mesh for treating prolapse is not, and has been taken off the market for that reason. Using it underneath the urethra can be done very easily. Once placed, the urethra lies right above it. It creates a little support and prevents leakage every time you cough or sneeze. This is very safe to place and is done by making 3 small incisions, which makes recovery very easy. Let me show you a diagram. So that looks a little bit like this. You can see where the sling's placed right underneath the tube, and then it passes all the way up and comes out here. So 2 incisions here and 1 incision in the vagina are made to place it, and then it stays there permanently. When you cough or sneeze, it supports the urethra and stops leakage. Here's another picture of what that would look like. So you can see the mesh comes down and behind the pubic bone, underneath the urethra and back up, and a very small piece is left in place. It's very effective for treating this. In fact, long-term success over 20 years is in the mid 80% range. That's wonderfully better than anything we could have done in the past. So it's very easy to undergo, has very good success with very low complications. In fact, the complication rate for this is lower than it was for the other surgeries we used to do. So this is a very good option for a lot of women. I even had a patient who chose to run a marathon 2 weeks after her surgery. I didn't recommend it, nor did I know she was going to, but she called me at the finish line to tell me she didn't leak throughout the whole marathon and was very, very happy with the success of her surgery. That is how successful this procedure can be, and it's very easy to undergo, returning back to normal life within 1 to 2 days. It may be an option for you, and if you'd like to talk more about it, I recommend speaking with a subspecialist in urogynecology like myself. You can learn more about this by going to our website at thewomencenter.com. I'd recommend clicking on the ebook that I wrote on A Woman's Guide to Incontinence. Let me show you what that looks like in case you choose to look that up. At our website, which looks like this, you can scroll down and you'll find that on the mid-page, A Woman's Guide for Urinary Incontinence. And I recommend that you consider reading through that if you have more questions. Otherwise, tune into my YouTube channel and I'll provide more information on other topics.